Hello, good afternoon, everyone.
Good afternoon, sir.
Good afternoon, sir.
Hope you are doing well.
Yes, please. The grace is sufficient. Please, I am.
Yes, sir.
I'm doing well. I think we got to the bacterial infections last time. Any confirmation? We got to this point. Any confirmation, please? We did this. Serological assays. Hello? You want to confirm?
Yes, sir, please, we got it.
All right, thank you. We talk about infections caused by bacteria. And we know bacteria are everywhere. And because they are present everywhere, we can encounter them, and the bad ones or the harmful ones can result in infections if our immune systems are not able to contain them. And very few, but the few ones cause infections that far outnumber the infections caused by viruses and other parasites. So we have the good ones that colonize humans, animals, and then do not infection. So those are the normal flora. And bacteria could be transmitted to humans or animals to cause infections through vectors that can transmit from one person to the other or from one host to the other. And these can be gotten through contact with infected individuals, through air droplets or vectors. These infectious agents could also lead to infections when we come into contact with these objects. And when it comes to bacterial infections, there's symptoms or signs and say these are bacterial infections because they overlap with those of the viral and parasitic infections. That is why diagnostic is very important. If you don't take the samples and investigate, you might not be able to know the actual cause of the infection. And regarding treatment, because we have a lot of antibiotics, several options are available, and bacterial infections are easy to treat compared to viral infections because the virus keeps changing and getting treatment sometimes becomes a challenge. But these days, we are facing problems because of antimicrobial resistance. The bacteria are developing resistance because of the drug pressure or the continued use of these antibiotics, as well as chemicals that with time they are able to resist or become insensitive to. And because they are becoming resistant and treatment is not working, the rate at which the infection is transmitted also increases, and people mostly lose their lives as a result because the options available for treatment have been lost. So for bacterial infections and diseases to occur, there are some key features of the bacteria. One of them is infectivity. If in the population people are exposed to these bacteria, what makes them able to cause the infection depends on how they are able to infect those who are susceptible. So assuming we have two different bacteria, A and B, if for bacteria A, exposure to about 100 people will result in 80 of them getting the infection. And for bacteria B, exposure to the same 100 people, 30 of them become infected. That means bacteria A is highly infectious compared to bacteria B. The number of individuals who become infected when they are exposed to these organisms because of the property of these bacteria. So infectivity is one area we look at when we are considering epidemics. The other property is pathogenicity. Once a person gets exposed to the bacteria, what is the probability or the potential for that bacteria to cause disease? Remember, infection is different from disease. So once a person is infected, the potential for that bacteria to cause disease, that is pathogenicity. And the degree to which the disease develops, the severity of the disease is what's referred to as virulence. How we get the differences? Hello, is it clear? Do you get the differences between these three? Hello? Don't get confused with these terms. So, infectivity. All these properties, infectivity, pathogenicity, virulence, have to do with the organism that is causing the infection, not the host. Take note of that. So, the infectivity of the organism. So we are looking at bacterial infection. So the infectivity of bacteria determines how many will become infected, how many hosts or how many individuals will become infected when they are exposed. So assuming there are 100 people in the community who are all susceptible, when they get exposed to these bacteria, assuming they consume contaminated food, 100 people of them, they are all susceptible. The infectivity of that bacteria in the food depends on how many of them will get the infection. So if 80 out of the 100, all the 100 consume the food that was contaminated, 80 of them develop the infection. That means the infectivity is high. If all the 100 who are susceptible consume the food, and let's say 10 of them develop the infection, the infectivity of that bacteria is low. So the ability of the bacteria to cause the infection, that means invading the cells or the tissues, overcoming the immune system, and then multiplying, all these will lead to the infection. So the ability of the organism to invade, overcome the immune system, multiply, and achieve infection. That is the infectivity. Is it clear, please? Before I move on.
Yes,
Hello.
sir.
All right. Thank you. So let's move to pathogenicity. Has to do with the disease. So the infection will now progress to a disease. And that's what we refer to as pathogenicity. And mostly it's about not treating early, not detecting early, or when the tissues or the organs begin to get impaired in terms of function, or there is damage. So the measure of that pathogen, this time you're talking about bacteria, to progress from infection to disease, that is pathogenicity. And some are more pathogenic than others. They cannot achieve infectivity, but some will develop into diseases. Those conditions will develop from infection to diseases faster than others. So the pathogenicity of those organisms will be different. Then virulence is about the degree, the severity of the disease. So moving from the infection to the disease, how severe is that disease? That is virulence, the degree of severity. So a measure of the pathogenicity, a measure of how the disease results, that is virulence. Is it clear now, please?
Yes, sir.
Thank you. So we move on to the host. Remember, these attributes are for the bacteria, the pathogen. So infection and disease will depend on these attributes. Infection also depends on the host. Disease also depends on the host. If the genetic material, the DNA or the genome, the genes change, it can make the host susceptible to the infection and then the disease. That's why some diseases, we see them in some African population and not common in the Asian or the Europeans. Some diseases, we find them associated with the Europeans, but not Africans. It's because of the genetic makeup. Then nutritional status. This can also affect how the infection and then the disease also progresses. And mostly, the immune system also contributes to the severity of the disease. Age also is a factor. Children are at a higher risk because the immune system is not developed. The aged are also at a higher risk because of immune compromised system, and then duration of exposure. How long you get exposed to these bacteria. So if there is overcrowding and we have people who are infected, they cough, you get exposed to them, assuming you are traveling together with these people and it's a long journey, 4 hours, 5 hours, because of the duration of the exposure, the long exposure, you're likely to develop the infection. Because the more you spend time with these people, the infectious dose will also increase. The number of bacteria that you get exposed to will also increase, and the chance of developing the infection will also increase. Some underlying conditions also weaken the immune system and make room for these infections to occur. You have people who are carriers and are not aware of their conditions, and they keep spreading the infectious agent. And this is one way typhoid fever keeps spreading, because you have a lot of carriers around and they are not even aware they harbor these Salmonella typhi. We have meningitis also spreading through people who are carriers of Neisseria meningitidis. That's why we're seeing a lot of these outbreaks in the secondary schools, because there were a lot of carriers. We can also have these infections coming from the animals. So the pets or the wild animals that we come into contact with, and eventually we get the infection. So if somebody is living with animals, the chance of getting the infection is higher than those who don't live with these animals. The environment also plays an important role when it comes to the spread of these infectious agents. Because these are sources of infection, how often you get into contact with these environments, as well as some chemicals that can weaken the immune system, will also predispose the individuals to these infections. That's why hospitals, we have a lot of patients there. So they come with diverse conditions, infections, and it's a hotspot for infections to be acquired. That's why we advise health workers to be extra careful. You don't know what the patient or the client is carrying. So always protect yourself and others from getting the infection. There are several sources of bacterial infection, and some of them include the sewage plant. So the waste that we generate in our homes, in the hospitals, ideally they are supposed to be channeled to a treatment center so that they are released back into the environment with low levels of the pathogens, or without pathogens in this water. So we have recycled water for reuse. But sometimes the plant may be faulty and will not be able to treat the waste well, and they are discharged into the water bodies, which will contain the bacteria. Then you can have runoffs from these toilet facilities or refuse dump, which will contain the pathogens. They end up in the streams. We go there to fetch water, and then some of them will be getting into our systems. People also go to swim and could get the infections. These sewage treatment plants will also lead to the effluents getting into underground and then being pumped by Ghana water. If the treatment is not effective, then we get them in our homes. Or if we have the boreholes in our homes, we could be pumping them directly if we don't have filters. You can have animals also discharging these wastes, which contains the infectious agents, directly into the reservoirs or into the water bodies. So these are several sources of the infection, and they can be transmitted through contact with people who are infected directly. You can have vectors who bite the infected people and then carry the pathogens to us. Animals could also bite other animals or humans, or they could pass the feces which contain the infectious agents. You can also have sharp objects being sources of the infectious agents. Flies could move from refuse dump or toilet facilities and directly settle on our food to transmit the infectious agent. We can have dust which will carry the infectious agents in the air and then settle on our food. Some dust could also be inhaled or get into our eyes, and we may have the infection. Sometimes people will have open wound that could also carry these infectious agents and could worsen the infection. So there are several routes of transmission. So bacterial infections, as I said, the symptoms and the signs are non-specific to only bacteria. And there are some sites that bacteria prefer to harbor. There are some that will harbor or dwell in several places within the host. For instance, if you have patients reporting with symptoms of meningitis or signs of meningitis, you may have in mind bacteria such as Neisseria meningitidis, because it's about the central nervous system. But if someone comes with skin infection, Neisseria may not come into mind because these organisms are not associated with skin infections. So some of these manifestations are associated with particular bacteria. But you could have Staphylococcus aureus infecting the skin, soft tissues, bloodstream, intestinal tract, and for such infections, if we have skin infection and bloodstream infection and the outcome is Staph aureus, it's not questionable. But if we report skin infection resulting from Neisseria meningitidis, then it's questionable and you may have to repeat the test. And some of these infections will lead to diseases that could destroy the cells or tissues, or in some cases, the organs, as a result of the immune response, and sometimes could lead to sepsis. Sometimes the infection becomes systemic and leads to inflammatory response syndrome as a result of high reaction from the immune system, and mostly it causes instability in how the blood flows as a result of these antibodies and other immune mechanisms that are fighting the infection. And mostly, if treatment is not adequate, it may lead to sepsis, and in some cases, the patient may lose his or her life. When we talk of bacteria, it can be found everywhere in the environment and even in humans or animals. So it's not always the case that you find bacteria in some sites and will report them as infections because that's where they colonize. They live there without causing harm. So that is commensalism. But some of them could move from one site of the same person to another site within the same person and result in infection and disease. So in the nose and throat, we have bacteria such as the oral streptococci, Streptococcus pyogenes, Streptococcus pneumoniae, and Neisseria species. So if somebody presents with meningitis, you may find the Neisseria species in the mouth. which are normal flora, but finding them in the brain or in the cerebrospinal fluid, that's the infection. Can have Staphylococcus epidermidis, Haemophilus influenza, all are normal flora in the mouth, but they can end up in the brains or the central nervous system and cause infections or diseases. Same as in the mouth, can have some yeast that are not bacteria, can have some bacteria like the oral streptococci. You can have a lot of bacteria on the skin and the scalp. So here you also find Staphylococcus epidermidis, Staph aureus, diphtheria, some streptococci on the skin. So if you are taking samples from the individual and then the site is not well cleaned, disinfected, you may end up introducing the contaminants into the sample. And the lab person may report that as positive, meanwhile, it's contaminant from the skin. Can have perineum and lower limbs having these normal flora. The lungs are supposed to be sterile. So you can have these normal flora ending up in the lungs and will result in infection. The stomach is also supposed to be sterile because of the high acid content, but there are some bacteria that can tolerate these high acids and the normal flora. So the yogurt that people consume contains some of these acid-tolerant lactobacilli. We have a lot of bacteria in the small intestines, the large intestines, and they don't cause infection. They even help with digestion of food and prevent others from also growing in the same area by maintaining the pH. In the urethra and the vagina too, we have some bacteria, some fungi. Sometimes they can overgrow and result in infections. Some of these also prevent other bacteria from growing to cause infections. That's why the use of chemicals or some antibiotics that sometimes clear these normal flora will make way for other infections to set in. So these are infections as a result of bacteria. Sometimes they don't behave as normal flora again because they have moved from one site to another. The central nervous system is supposed to be sterile. So if any of these bacteria find themselves there, Streptococcus pneumonia, Neisseria, which was in the mouth, once it gets into the central nervous system, then it can develop into the infection and then disease. Listeria monocytogenes, Streptococcus agalacea. In the ear, you can have Streptococcus pneumonia. You can have pneumonia as a result of Streptococcus pneumonia, Haemophilus influenza, Staph aureus, Mycoplasma, Chlamydia, Legionella, and then you can have tuberculosis as well. You can also have infections in the gastrointestinal tract as a result of contaminated food or water when they are ingested. So Campylobacter, Salmonella, Shigella, Clostridium, Staph aureus, E. coli. So you can find Staph aureus in so many sites and cause infections. In other sites, they are also normal flora. E. coli, you can have some in the gastrointestinal tract that are normal flora, but some are also infectious. You can have high infections from these bacteria. Naturally, when these bacteria get into the eyes, because of the tears that we shed, we're able to get rid of these bacteria, and then the lysozyme enzymes in the TS could also kill or inactivate these bacteria, but sometimes some of them develop into infections. You can have UTIs caused by E. coli, other enterobacteria, the gram-negative rots, the Staphylococcus, some Pseudomonas aeruginosa, and you can have sexually transmitted diseases resulting from chlamydia infection, Neisseria, gonorrhea, Treponema pallidum, Uroplasma, Erythrolyticum, Haemophilus decree. Aside having some of these bacteria as normal flora on the skin, some of them can also result in skin infections. So you can have skin infections caused by fungi, you can have skin infections caused by bacteria. And usually when there is a cut in the skin, you can have some of these normal flora also overgrowing to develop into infections. So this brings us to the end of microbial infections. Any question before we move on to the next unit? All right, so we move on. Okay, so unit 3. We shall be talking about specimen collection and processing. If you want to diagnose properly, you may need to collect samples, sometimes process them, use some materials or media that have nutrients to support the growth of these organisms, and then you culture them, you grow them, they become high in numbers, and then you can detect. Sometimes you need to stain them and know whether they are gram-positive, gram-negative, or they are acid-fast bacteria. So the first part is general specimen collection and processing. If you will diagnose properly, depends on how well samples are collected. Or the specimen. Specimen is what you collect, and the sample is a part of the specimen that you use for the measurement or the testing. Sometimes we interchange specimen and sample because in some cases, the entire specimen becomes the sample. You use everything. But technically, specimen is what you collect. Sample is a part or a portion of the specimen that is analyzed or tested or measured. So if you select the proper specimen, are you using stool or urine or blood for that particular diagnostics? Very important. If somebody presents with symptoms or signs of malaria, you don't take stool sample because the parasites do not live in stool, they live in blood. So you collect blood specimen. How well you collect the sample, how they are transported within the time frame of transport could also affect the diagnostics. So the specimen that you collect should be representative of the disease. So whatever you collect, if it's UTI, I believe you don't collect saliva specimen. You collect the urine because you're likely to find the pathogens in there to represent the urinary tract infection. Okay, and in the collection of these specimens, the adjacent tissues or sites should not be touched so that you don't contaminate or cross-contaminate the organisms from one site to the other. So if you are collecting blood, there shouldn't be contamination of the blood sample with the normal flora on the skin, because those sites are close to each other, you may be able to have the contamination. I saw a hand up, or is an error? So the site is very, very important where the samples are collected from. If there is a deep wound infection and the specimen is taken from the superficial site, you may not get the actual cause of the wound infection. It may be reporting different bacteria, but not the actual one in the deep wound. The timing is also important. For some specimen, early morning is better. For some specimen, like blood for bacterial culture, the person shouldn't start taking antibiotics before the samples are taken, because it could affect the results. So timing is very, very important. And we advise before samples are taken, some information should be obtained from the client or the patient, so that if the results change, you may know why so. So always practice aseptic techniques, use the right consumables, sterile consumables, and equipment. Sometimes the contamination will be coming from using consumables that are contaminated, and this could also affect the results. The equipment that are used to work on these patients or clients could also end up contaminating the specimen. Always note the right volume to collect, and these volumes vary from one test to the other. The volume of blood needed for blood culture is not the same as the volume of blood needed for malaria test. So if you are not sure, always ask the facility the volume before you collect them. And after collection, always put them in the right containers, leak-proof, well-labeled containers. And before the samples or the specimen are collected, make sure all the things that you need for the sample or the specimen collection are available. Don't start to collect the specimen and then later ask where the containers are. So have a checklist of all the things you need for the procedure before you begin. And single-use consumables should be discarded appropriately. You know where to discard the sharp objects and the other objects, to you know where to put them. Don't leave them on the bench. As soon as you are done, you discard. And usually, specimen will come with a requisition slip. There should be a reason or purpose for collecting the specimen. And the results should be also relayed to the healthcare provider without delay. We always see lab people receiving the samples. After running the test, the results are ready, then they keep the results. They don't inform anybody, and the patient suffers. So always communicate and then get the results as soon as possible. And for the request form or the requisition form or the requisition slip, this information are needed: the patient's name, the age of the patient, the gender. Age, because for some specimen, we have the limit for children, the limit for adults. So if you don't know the age and the sample arrives, you will not know whether it was taken in excess or the volumes are low. The gender also is very important. Identification or hospital ID, the location where the sample or the specimen was collected. Was it at the OPD, at the emergency unit, at the ward? Very, very important. Sometimes you may have multiple samples or specimen coming from the same patient. Assume the person went first to the OPD, the specimen were collected, then the person got admitted, and then in the ward, another sample was collected. If the location is not specified, it will be difficult to track the process and the timing of collection. Then the healthcare provider should also indicate his or her name, and sometimes the specimen are going to another facility. It's important to include the contact so that if there is any information, they could also get them. The time of sample collection and the date, very important. So sometimes the specimen could be rejected when the right specimen were collected, but information like the time and the date will not be available. So they could be rejected, and then these could be corrected and accepted back. So always rejection is not suggesting that the sample has to be discarded. Sometimes you reject in the initial stages, and then once the conditions are met, they are accepted back. The specimen type, very important. Please mute. Eunice. Sometimes, based on the diagnosis or the test required, if it's for malaria and on the slip you see urine, then it's questionable. Sometimes you may see blood sample or specimen required, but the container will not be a blood sample collection container. So once the sample type is specified, then the one taking the sample will know the right container to use. And the diagnosis or the test required will also give you an idea of the type of container to use. If you need anticoagulated blood or you need clotted blood, it depends on the diagnosis or the test required. But we shall limit our discussion to microbiology. So we are going to look at the organisms that are in the sample responsible for the infection. So we are not going to talk about chemistries or hematology. We are limiting ourselves to the bacteria, the parasites, the viruses. All right. And the samples or the specimen should be transported as soon as possible. There should be no delay. Sometimes delays could affect the results. For some specimen, they could be kept at fridge condition, so 2 to 8 degrees Celsius, if there will be a delay in transport. Assuming the sample or the specimen was collected from a facility and it needs to be sent to another facility, and it's going to take like 2 or 4 hours. For some of them, you can keep them in the ice chest with the ice pack in it and a thermometer to monitor the temperature. But there are exceptions. If the blood sample is for culturing, you want to grow the organisms, we don't advise keeping in the low temperature. Keep them at room temperature. That's why sometimes samples get rejected because of the storage condition. Same for cerebrospinal fluid. The purpose of the specimen is very important. If this is for PCR, polymerase chain reaction, keep at -2 degrees Celsius, 2 to 4 culture. You keep at room temperature. That's why I'm saying always note the purpose and the right condition. If you are not sure, you ask before the samples or the specimen get rejected. So mostly you hear from facilities calling to ask that they have this suspected case, they are about to take the sample in which conditions safer side. There are some organisms, especially the anaerobes and the fastidious. Fastidious organisms are the ones that require extra nutrients before they can grow well. So if you keep them at low temperature, already they take a long time to grow well. So the time for adapting may be delayed, and that can affect the growth rate. But if you keep them at room temperature, around 25 degrees Celsius, it's easy to rise from 25 degrees Celsius to 37 than to rise from the fastidious and then the anaerobes to grow. An example of fastidious organism is Neisseria gonorrhoeae. Another example, Bordetella pertussis or Trichomonas vaginalis. And if the purpose is for malaria screening, keep at room temperature. For malaria, they prepare the thick and thin blood smears on the film plate at room temperature. So sometimes samples or specimen get rejected due to the improper transport temperature or storage condition, using the wrong container or medium for the specimen collection. If it stays very long, assuming it needs to be processed within 2 hours and it comes after 24 hours, that means it needs to be rejected, or another sample has to be taken. If the specimen is not well labeled or not labeled, it could be rejected. If the container for the specimen is broken or there's a crack, that means there could be some contaminants getting in there and it needs to be retaken.
Why?
Please mute. Rosalind. Sometimes you have leakage from the specimen. So when the specimen is collected, all these have to be checked. The labels, is there a crack or is there a leakage? All these have to be checked before they are transported from one facility or one unit to the other. If the specimen comes out dried, sometimes organisms may also die because water is needed for microbial growth. That's why for some specimens, they are collected into medium so that the organisms could be sustained and they will survive in the course of transport. Using the wrong specimen for the requested test, if blood is requested and urine is taken, it will be rejected. Sometimes there could also be a mistake or miscommunication from the healthcare provider, the one requesting for the sample. So the one who took the sample only based on what the requisition slip stated. But in that case, it will still be rejected. So there should be communication between the various units so that the right sample is taken. Inadequate volume is also a challenge. But sometimes there's nothing you can do about it, especially if it's an emergency case and results are needed right away. For the lab people, if the volume is inadequate and it's emergency, they have to start working on the inadequate volume. In some cases, they can make do with the inadequate volume and then request, if possible, another specimen could be taken. It's better to save life by working on this inadequate volume than to reject it and wait for another sample to be taken and then the person loses his or her life. So it's about communication between the units. For some samples, the inadequate volume may be a challenge. And for that test, you need to use another means. And if the facility does not have, then becomes a problem. Sometimes the person underwent surgery, and that was when the sample was taken. So getting inadequate volume, would you ask the client or the patient to go back to the theater because you want to take another sample? No, you have to make do with what you have. But at best, you should always try and then get the right size or the volume needed. For culture, we don't keep samples inquisitive, so they'll be rejected. That's why the purpose of the specimen is very, very important. And usually we see the lab people rejecting the samples. Yes, Emmanuel.
Please, the last point. We don't keep culture inquisitive. Please, I don't understand well.
So we have samples or specimen. For example, you may have stool sample that is kept in a inquisitive because you are not going to culture. You are just going to do microscopy. You're going to observe under the microscope. But if the purpose is to grow the microorganisms in the specimen or the sample, when you fix, you end up killing the microorganisms you want to grow. You have fixed them. Fixative is to keep the cells intact or the tissues intact. And once you fix, you are ending up killing the organisms you want to grow and multiply. So if it's for culture is the act of growing or cultivating these organisms. We don't advise keeping them inquisitive. Emmanuel, is it clear?
Yes, please.
All right.
Thank you.
Welcome. So sometimes we hear or we see these lab people rejecting the samples or the specimen without communication. It is very bad. It's unethical. They should give reasons for rejecting the specimen. And rejection does not always mean that the sample has to be discarded. Sometimes they are rejected and some information is needed before the specimen could be processed or worked on. So you can reject and get the proper information and then you don't reject again. Sometimes you keep the samples in the wrong container. That one, you'll be rejected for them to be put in the right container. You could keep them in the right temperature, assuming last sample was collected. You keep at the right temperature, but you had the last sample in syringe and needle. You don't collect blood sample in syringe and needle, so it has to be rejected to be put into the right container. So there should be communication between the units why the samples or the specimen were rejected. Yes, Emmanuel.
All right, thank you, sir. So it was actually in mind for me to ask, but you just mentioned it, so I want to ask a little question. So, explain why we don't take sample with syringe and needle, because I think when I was in school, we went for this blood screening, and then there was this tube that has a needle, and the EDTA bottle is attached to
Is it
that
the
tube.
butterfly needle?
No, there's it looks like the barrel of I mean the syringe, but there's a needle attached to it. So that one is introduced into the vein, and then the EDTA bottle, the cover is not removed. It is plugged onto that one, and then it pulls the blood onto
Yes.
the bottle. But
That's
the
the
question,
butterfly needle. The butterfly needle.
okay, but the question actually is the why we don't pick blood sample with syringe, and because I mean it's a very common practice that we do every day. So why?
So you need the syringe and the needle for collection. And usually for the needle, you need to use the right gauge size. If it's an adult or a child, you have to use the right gauge size. But the problem is you can collect it in the syringe with the needle fixed on it, but don't keep the blood in the syringe. It needs to be released or put into the right container for collection. That's the problem. The problem is not collecting the sample with the syringe and then a needle. The problem is keeping the blood specimen still in the syringe, which is not advised. Is it clear?
Okay.
Some facilities they don't have the butterfly needle, which is connected to the cap where you fix it directly onto the collection tube, the red, the purple cap or the yellow cap of or the green cap. So such facilities they use a normal syringe and needle to take the sample and then aseptically release the last sample into the collection tube. But don't keep the sample or the specimen in the syringe and send to the facility or the lab for them to start working on. Some facilities will have the sample or the specimen in the syringe with plaster covering the tip of the syringe, which is not advisable. You can easily have contamination. All right. Calvin, you have a question?
Hello, sir.
All right.
Hello, sir. Yeah, good afternoon.
Good afternoon.
With this issue of syringe and needle and sample, sometimes we are asked to do bedside clotting when it comes to snake bites. And usually we use the syringe and needle, we pick the sample, and we keep it there and we monitor. So in that sense, do we say that usually gives us wrong clotting time? Thank you.
So it comes back to the purpose of the specimen, what is going to be used for. For some specimen, you need a clotted one. For some specimen, you don't need a clotted one. So if you need the anticoagulated sample, always make sure you have an anticoagulant available for collection. For some samples, you need the clotted form. So that one, you need to have a clotting factor, or you can make them clot by keeping the sample in the right container, and then you are good to go. Is it clear? So it depends on the purpose for the specimen collection. Usually for microbiology work, if it has to do with blood, we don't encourage using clotted blood. So for snake bite, you are not interested in culturing, I presume. Is that the case, Calvin?
Hello, sir.
Yes. Yes. Hello, Calvin.
Yes.
Are you okay?
Yes, but what I want to know, so that means that it's inappropriate for us to use a syringe and to do the bedside clotting.
It's not inappropriate. The challenge is keeping the specimen in the syringe. That's the problem.
Okay.
You get the difference. Some
Yes.
people will use the syringe, the needle to collect the sample, the specimen, but will end up keeping the specimen in the syringe without putting them in the right container.
Okay.
So don't use the syringe as a container. It's just for collection.
Okay. Okay.
So once you use the syringe and the needle, put the specimen in the right container and then label it. But here we see people or the lab or the healthcare provider labeling the syringe, which is not advisable. Sometimes they put plaster on the syringe and then they label and send to the lab for the analysis to be done, which is what we discourage. Is it clear? Yes. I saw Munira and then Emmanuel. Yes, you may ask your question.
Good afternoon, sir.
Good afternoon. So you are
Munira.
okay.
Okay, so for my situation, like sometimes when we are doing procedures in the theater, let's say antral lavage, then we perforate the antrum and we see pus coming. Then we just use a syringe to draw some of the discharge and then we take it to the lab. So in that, are we going to get the right results from the lab investigation? Because that's what we have been doing for a very long time. Is that practice also wrong? Like, what should because we've been doing it.
Are you talking about the fine needle aspirate?
No, not fine needle aspirate. It's the syringe. It's a, let's say 10 cc,
Okay.
and let's we are in the maxillary antrum, right? Then we trying to wash it, but later when we perforate it, we see that there is pus coming out.
Mm-hmm.
So we just use the 10 cc syringe to draw some of this pus. We
Before
label.
you collect.
Yeah,
you are transporting the pus.
We are transporting it in the syringe to the lab. So that one.
You don't transport in the syringe. That's the problem.
Hey.
We don't transport samples in the syringe. It's a bad practice.
So said,
yes.
In that situation, what can we do? Because we need we don't have these containers at that point.
So we just yes. Ideally, the facility should be resourced to have these containers, but in our situation, resource limited settings, so sometimes you are put in a tight corner. The reason for rejecting some of these samples in the syringe is that you can have contamination, especially if it is not well kept. 2, you can have the needle pricking someone who is going to work on the specimen. And 3, sometimes you can have, if the specimen was collected halfway and the specimen doesn't need to come into contact with a lot of oxygen, you can have air build up in the syringe, and that could affect some of these processes. So when you keep them in the right container, then you label, we are very sure of the right results. Sometimes the results are compromised because of how the specimen were handled.
Yeah.
So this is the reason why we don't encourage keeping the samples in the syringe.
Okay.
But we understand the resources are not there.
Yeah.
But this is a discouraged practice anyway. Yes, Emmanuel.
Thank you, sir.
Welcome.
All right, so please, my question is, especially with respect to drawing of blood sample. What has the diameter of the needle got to do with the whole results? Would the diameter of the needle has any influence on the sample that we are taking, especially for blood samples?
So usually we don't expect to use the larger diameter for children, right? That is one.
Okay.
When taking samples or specimen, there should be less injury to the one whom the specimen is being taken from. That is one. And the flow of the blood into the syringe or the container is also a factor. So if the diameters are not the same, the pressure is also not the same, and the flow also could affect some reactions. But for bacteria, for culture, that has nothing to do with the size. But for some chemistries, there are some reactions that are highly sensitive, so they could also affect. But usually, we focus on not harming the individual, especially these children. Right. So somebody's asking the collection of what, please? I'm not getting the last part. Is there a hand up? Did I see Emmanuel again? Oh, Emmanuel. All right. So Munira, also take note that for the pass, yes. So the container should be sterile. So in that case, you can use the urine container.
Okay.
For this collection, because the for TB analysis, for some pleural aspirate, you also see urine container being used if the facility doesn't have the tube.
Okay. Okay. Thank you very much, sir.
For collection. Yes, but it should be sterile. One bottle which may be sterile to come for collection. But these days, we see people being directed to some places to go and buy, and they use. The purpose of collecting the pass will differ depending on the test required. Usually, when it has to do with culture, you want to grow the microorganisms. The pass is not the right sample to use, but you want to grow organisms in the sample. So you need where they are growing, the viable ones use. So reusing of sample bottles is discouraged. That's why we call them consumables. Single use container well. So it's a bad practice. Reusing, some investigations refer capillary collection into venous blood. Yes. So it depends on the test required. For example, if you want to do malaria test or the venous, for some, if you want to measure HB, you can use the capillary or the venous. For some, venous. So it depends on the purpose. Somebody is asking, the syringes are also sterile in wrappings. The fact is, you don't know. So we have syringes. When you are buying these materials or consumables, we have sterile and we have non-sterile. Some of them, you have a lot of syringes packaged into one bag. So once you open that bag, assuming there are 25 or 50 in a bag, once you open, you have exposed all of them to the environment and they can be contaminated. But usually, if they are sterile, you have a single in its own bag. So take note of that. That's why you don't reuse. But once you open, single use, they discard. Yes, there's hello.
Please, with the task collect, would it be advisable to, let's say, go to the lab, request for these swab on stick containers, and come and put it in the theater for such cases? Or does that one also have an expiry date on it?
So if you are using the swab stick,
yeah,
the question is, what is the purpose of the specimen?
It's for culture and sensitivity.
So usually if you collect in swab, you keep it in a medium.
Yes.
And if the facility doesn't have the medium, sometimes it becomes a challenge. Or if you are working on the sample in the same facility, so you collect from the unit, then within a few minutes you transport, that one is acceptable.
But say, so it wouldn't be advisable to, let's say, we are taking 5 of these to keep it safe over there, so that when we have a situation like that, we will use it. Would that be advisable?
For the swab?
Yes, please.
Is it for the swab?
Yes, please.
Hello.
Hello.
So, yes, the other option is,
usually
we have these small tubes. The microcentrifuge tubes, the one they use for centrifugation. You can have some 2 mils, some are 1.8. We have some that are 4 mils. Usually they have this in the lab. That's what they use for collection of the serum, the plasma. So instead of keeping the specimen in the syringe, then it's better to either keep them in those tubes or the urine container than to keep it in the syringe. The syringe is not what we encourage the specimen to be kept in. If you are using the swab also, as soon as you are done with the swabbing, it should be put back into the tube for the capping. And some of the swab sticks also have medium in them. Then the other alternative is to put these specimen in the containers, the tubes or the urine containers, and then label it. Yes, the expiry date is also important because it could lead to a rejection of these bottles.
Thank you.
If the stores are issuing these, they have a unit for a long time, and the expiry also becomes a problem. sample bottle contains antimicrobial solution. So if it contains antimicrobial solution, that means it's going to kill the H. pylori itself. But we have we shall come to the culture media others and allow others to grow. We shall come to those ones. So concerning the storage of the sample, the body temperature is always 37, around 37. But when you collect the samples, you have to store it in a lower temperature. So that's why I'm saying it depends on the purpose. If it's for culture, keeping it at room temperature around 25. Now, sometimes our room temperature could be 28. 25 degrees Celsius is closer to 37 degrees Celsius than to keep it at 2 to 8 degrees Celsius, very low. Low temperatures will slow down the rate of growth of these organisms. And some of them, they grow slowly. So for them to even grow at 37 is slow. And at 2 to 8, it will take a long time for them to adapt from 2 degrees Celsius to 37. That's why it's better to keep them at the room temperature. Even at the room temperature, some of them will still be growing because we have the between the minimum and the optimum temperature. So some of them will be growing. There are some samples that you can keep at low temperature. Some of them you can keep at low temperature if you keep them in the culture medium to sustain these organisms. And if the sample cannot be transported within the shortest possible time, then you can keep them at the low temperature, but also note the time of collection and the time the sample or the specimen was received so that you can go back to it if there is any problem. After taking your sample with the needle and syringe, is it advisable to puncture the cap of the sample bottle? So sometimes you may need to put them in the culture bottle. The culture bottle has that rubber-like cap. But before you puncture the cap, make sure you sterilize or disinfect the top before you cap it. You puncture. Otherwise, you may introduce some contaminants from the lid of the bottle inside. Okay. Usually we don't encourage for those bottles opening the lid, that rubber-like lid, to release the samples or the specimen directly. That's why it's rubber-like, so that you can puncture and then put in the blood or the sample if it's pleural spirit. Right. Thank you. So we move on. I hope your questions are addressed. Okay. So sometimes there could be mislabeling, which can be corrected. And sometimes the sample should be recollected, especially if more than one person is involved. You don't know whose sample is what. In some cases, relabeling of the specimen is acceptable if retaking the sample or the specimen is difficult to do. As in the person came for surgical procedure, the procedure is over. You cannot ask the person to come back because you want to take a new sample. So always take note of some of these conditions. That's why for some requisition slips, the location also is very important. Once you indicate emergency unit, emergency is emergency. So for that one, there's no delay. If the sample was collected from the lab, that's not an emergency case. So recollection of the specimen could be possible. By emergency, the lab person also is trained to attend to emergency cases as emergency. So rejection is not always the solution if there's a possibility to get the information needed and then proceed rather than to reject it because you have a beef with the nurses or the midwives. When it comes to human life, you have to put all emotions and other issues aside and then save the life. That's why communication is very, very important. All right. So standard precautions before you handle any sample or any client, any patient. The person may look nice, but you don't know the organisms in the person. So always protect yourself from the specimen or the person you are working on. You don't see microorganisms with your eyes, so always be on the lookout. Be conscious of your environment. That's why we encourage the use of gloves. You wear your lab coats, your gown, your nose mask, protective eyewear in some cases, if it's the theater or it depends on the sample you are or the specimen you are collecting. In some labs, they have designated areas for processing and collection of specimen. So those areas should always be clean, sterile, so that you don't cross-contaminate the specimen. But we have specific recommendations for each specimen type. So we shall look at some of the recommendations for blood specimen collection. Because the blood will be collected from the veins or the capillaries, we encourage cleaning the site, the skin before collection. Otherwise, you may end up introducing the normal flora from the skin into the specimen. So if you have observed, most labs will be reporting contamination because of how the specimen were collected. Then blood from different patients should be collected into different containers, which is of course true, or different culture bottles using different needles. This is where the problem comes in. Assuming the suspected case requires 2 different blood samples to be collected from the same patient. So one for anaerobic culture, one for aerobic culture. In that case, 2 different blood samples are needed from the same patient. And we don't encourage, if you are using the syringes, you collect from one site, then you share between the 2 bottles. We don't encourage that. Collect from different sites into the different bottles so that you don't introduce contamination from one into the other. So this is what the point is talking about. But if it's different patients, of course, you don't use the same needle. Use different needles because they are single-use materials. And make sure you label if you are dealing with so many patients or clients. And the timing is very important. If it's for culture, always take the blood sample before antibiotics or antimicrobials are given. Even if for malaria test, if the person is in the severe case, severe malaria, before the IV artesunate is administered, the sample should be collected so that it doesn't interfere with the results. So for blood, hello, Emanuela. All right. So, Prince, is it this point, venipuncture? All right. So, Emmanuel, let's hear you.
Sir, please, is it advisable, for instance, if I am passing IV cannula, and after passing, I take a blood sample from the cannula, is it advisable?
So, in which condition? That is one.
Like maybe we are treating a malaria case, and I will give IV attachment, but after passing the cannula, then I'll open the sample bottle to take blood sample from the cannula before I give the IV the attachment.
Okay, before I administer the drug. Okay,
Yeah.
that is fine. But in the river, that is not.
Okay.
But it has to be done aseptically so that you don't contaminate the specimen.
Okay.
All right.
Thank you.
So I think yes. So Prince, when you want to perform a venipuncture or phlebotomy, because the vein is not on the superficial part of the body, the skin will come before the vein. So you need to disinfect the area, the site where you are collecting the blood. Mary, please mute. We have feedback from you. You need to disinfect the site on the skin where you are going to take the blood sample. Remember, we said there are normal flora on the skin. So if you don't disinfect well, as you insert the needle will pick these normal flora that you don't see with your naked eye. And the blood will also push the normal flora into the syringe. So you end up having a normal flora in the blood, and blood is always supposed to be sterile. So once we find organisms in the blood, then there's an infection. So we'll be reporting positive microorganism in the blood. Meanwhile, it's coming from the normal flora of the skin. So this is false positive. That's why we encourage the site is well cleaned before the sample or the specimen is collected. Friends, is it okay? So mostly in some facilities, for every 100 cases, if they draw blood samples or specimen for culture, you may end up getting contaminants. The rate could be about 30 to 50%, which is very, very bad. Always reduce the level of contamination. Right. So the volume also is a factor for some. Yes, Evelyn.
Sir, please, what of patients with a central line? Mostly at my facility, if a patient is having a central line, we take sample from there. So is it advisable or?
And would that patient have undertaken, or would the person be undergoing treatment?
Yes, mostly the central line, it has 3-way. So they label one as for sample and the other 2 for medication or any other thing.
Yes. So if, let's assume the person came and was admitted, you have passed the line. Before you start the medication, you want to know the cause of the infection. That's when you want to take the blood, some specimen. So before you pass your medication or the drug, take the sample or the specimen first before the drug starts to work. Some drugs are fast acting. As soon as they get into the blood, they start to work. So we don't want an interference where the organisms in the blood will be killed with the drug you are administering. In some cases, after the first sample or the first specimen was collected, we want to monitor if the microbial load is coming down. If the person has initiated treatment, still on admission, day 2 or day 3, you want to check if the organisms are still in the blood. In that case, you can go ahead and take, because you know the baseline results. The day the person presented with the case, you know the outcome already. So you want to just compare previous results with the current results. Is it clear now, Evelyn?
Yes, sir. Thank
Right.
you.
Yes, Josephine.
Yes, sir. Please, from the same question with the central line. When they pass the central line, maybe a day or after 2 days or 3 days, and you want to take sample again, we were told that you withdraw 10 mils of the first blood and discard it. Let's say all the three way has been used for medication and nutrition and other things. So we were told that we withdraw 10 mils of blood and discard it, and then you withdraw a new blood. That new blood will be used for the sample you want to investigate. Is it the best way, or that's not advisable?
So the purpose, maybe you may have some residual blood in the line. So maybe you want to avoid that residual blood in the line before you get the actual sample. Or there may be some clots in the residues. So it depends on the test also, the required test. Is it for chemistry, is it for hematology, or is it for microbiology? That's also important. Are you getting the point, please? Hello? Josephine, we lost
Yes,
you.
sir.
Yes, Evelyn.
Sir, even sometimes they take it for ABG. They take that sample. As my sister was saying, they would just withdraw the first sample, then they would discard and take another one. But
Yes.
sometimes that sample is used for ABG.
Yes. That's why I'm talking about the purpose. If it's for immune analysis, you want to assess how the antibodies are faring or the immune response, or you are looking for microorganisms that will be present after treatment. You want to discard the residual blood in the line, so that whatever is coming out after the residual, you are sure it contains the markers that you are targeting. All right.
Hello, sir.
Hello.
Yes, sir. So, please, does it mean or does it confirm why it's always not appropriate to take, maybe if, for instance, maybe the patient is having urine catheter in situ? So, maybe we are doing culture of the urine for the patient, of which the catheter is still in situ for about maybe 2 weeks. So most of the times, the urine collection will be basically from the catheter bag. So as you said, you have gotten the baseline laboratory investigation, the result. Then maybe after 1 week, you just take another urine from the urine bag. Then you run the lab for microbiology on it. So with this one, even though you have the baseline, okay, and the patient is still having the catheter in situ, then you took another one. still, I know that, because of you are still using the same urine bag, microorganism can still, or the previous microorganism can still harbor in the urine bag,
Yes.
possibly. Yes. So I think it will, I don't know, like it will distort, or maybe it will misinterpret the baseline result compared to the new one you have done, or maybe you have to confirm when the patient has been discharged from the urine catheter, then you take the urine directly from the penis or something, so that you can give you a clear indication of whether the medication has actually reaching the therapeutic potential or something.
Yes. So this addresses the two, yours and then the earlier question. Sometimes the drug plasma concentration or the drug concentration in the urine that is collected in the catheter
Okay.
would still be present. They will be higher than what you are getting, you want to get from the patient or the client. So once you collect in the container, you still have the residual urine from the catheter and some of the urine from the client. And this concentration may affect the results. If you culture, you are going to culture with the organism with some of these residual drug concentrations in it. The same as the earlier question where the line, you don't discard what is left or the residual blood, and then you add on what you are expecting from the patient proper. And once you have some plasma concentration of these drugs, they could interfere with them when you are culturing. Remember, you'll be culturing for about 18 to 24 hours. So the organism will be in the culture with the blood plus the residual plasma concentration for about 18 hours. And this could inhibit the growth of these organisms. I hope it's clear.
Yes, please. Thank you.
That's why even for those who are on antibiotics, for UTI, if the person takes the urine even after 3 weeks, and this can affect the results. There was a hand up. There was a hand up. All right, move on. Okay, so always note the volume for children and then for adults. Depends on the test. So usually for the blood culture bottle, the volume needed is indicated. And we have bottles for pedics and bottles for adults. Don't go and use the adult bottle for pedics. Remember, it contains some anticoagulants that are meant for the volume needed for adult. Bottle that has anticoagulants and then the medium. You have diluted it and the growth rate will not be where the material, and keep at room temperature until they reach the lab if it's for culture. All right. For cerebrospinal fluid, if you collect this CSF, and it should be done by a qualified person, please. Yes, Munira. Munira.
Hello, sir. Please, yes, sir. When you were concluding on the blood, you said we have pediatric tube and we have the adult tube.
Adult.
I don't know if I heard. But
yes,
we find ourselves with this purple, yellow, ash bottles. We kind of use it across board for all categories of patients.
Yes. So we have, let me go back. So for blood culture, if the blood is meant for culturing, sometimes the facility may also want that same blood for hematology, full blood count, and other analysis.
Yeah.
That's why we have different collection tubes, color-coded. So anticoagulants, you have them in the purple, sometimes in the green if it's containing citrate. Then if it needs to be clotted, then you have the yellow cap. That one will be used for the chemistries and those tests. So if the facility, the result slip, the requisition slip wants this blood specimen to be used for culturing and then for hematology, that's why you provide these purple caps. Then you collect the anticoagulated blood, and when it gets to the lab, they will use some for the hematology and then some for the blood culture.
Oh.
But for some facilities, they have the blood culture bottle there. So once they have the butterfly needle inserted, they will collect the blood directly into the blood culture bottle and then collect directly into the purple cap for the hematology. Some facilities have that, but those other have, they collect in one purple cap, and then when it gets to the lab, they will make the aliquots aseptically into the required bottles for culturing, and then the hematology analysis. I hope it's clear.
Yes, sir. Thank you.
Right. So you move on. CSF should be to process them before they transport. And the CSF again, it should be at room tooth weight refrigerated for molecular analysis, PCR. If it's for culturing, you keep it at room temperature. That's why I'm saying the purpose is very, very important. And always avoid delays. So for culturing, you keep it at room temperature. I'm talking about culturing because it's microbiology. For PCR, you may also end up getting the pathogen, the virus, or the bacteria, but you are not going to grow them. You are just going to use molecular method to amplify, multiply the DNA. That's why you need it in the frozen, the refrigerated state. But for culturing, you need it at room temperature. Sometimes you may take more of the CSF, and some labs will process by first centrifuging, and then they concentrate the sediment, which will have the microorganisms. They will use that part for culturing. So once they concentrate, they are likely to have higher numbers in reduced volume of the CSF, and then they can get results as early as possible because they will be growing at a very fast rate. The numbers will be increasing very fast. Samples from the gastrointestinal tract, so feces, and in some cases rectal swabs if the person cannot pass the stool, or especially in children. And this is mostly for food poisoning or diarrhea or gastrointestinal tract infections. The container should be sterile. The fact that it is stool does not mean you should use any container. Don't treat stool like that. It should be a sterile container, please. Otherwise, you may end up contaminating the stool. The stool is already contaminated with a lot of bacteria, and then some other microorganisms. So don't add more contaminants. And if it is stool, usually we see stool sample with urine around it. So let's assume the person also has UTI. You may be contaminating the stool with the bacteria causing the UTI as well. So always take note and then advise the client when he or she is bringing the specimen. And you know, some of these toilet papers, the tissues, now they are medicated. They could have some antimicrobial activities against the specimen. So we don't encourage people bring the specimen and then they have tissue toilet paper inside the container, which we discourage. And it should be fresh stool. So within 2 hours of collection, should be sent to the facility for examination. The earlier the better. In some cases, if the time of collection and transport is not favorable, then they could be kept in transport medium so that the medium can provide nutrients and also provide the right conditions for the organisms to start growing before they are sent to the lab. So Stahl's, Ames, or Caribbean medium could be used as transport medium for these feces or urethral swabs. They are transport medium, and once you get them into the lab, you put the specimen onto the next medium for proper growing. So if it is not preserved, then it can maintain at the fridge temperature during storage and transport. But we advise you keep them in the transport medium. And if it's for microscopy, so if you want to get intestinal parasites, then that's where we mostly see the addition of the formalin. Or some could be fresh, to depend on the stage of the parasite you are looking for. Okay, so if the person came to the facility, was admitted, we'd advise if you need stool sample, it should be collected within the first 3 days for stool. If you want to culture or you want to have parasite examination, or you take the sample from the outpatients, and then that one you are okay to be getting the right bacteria or parasites. Beyond 3 days, you are likely to lose the bacteria. The person came to the facility, was admitted, stool sample was not collected day 1, day 2, day 3. After day 3, the person presented with diarrhea. You want to collect the stool after day 3. When the diarrhea is over, you may not be able to get the actual cause of the infection. Or if it's a parasite, you may not be able to detect it. But we have exceptions. For infections caused by Clostridium difficile, they produce some toxins, and those toxins could be detected in the urine, the stool, even after 3 days. So you may use the toxin produced in the stool to confirm the presence of the Clostridium difficile. Or some who are HIV patients, for those ones, you can still go ahead and collect the samples after the 3 days. And if there is an outbreak in the hospital and it results in gastrointestinal tract infection, the person has stayed there for more than 3 days. So this is an exception to the rule. You can go ahead and then collect because of the outbreak. And some children are unable to pass through, and after 3 days, fortunately they're able to do so. So you can use that stool specimen after the 3rd day for analysis. All right. For upper respiratory tract infections, usually nasopharyngeal aspirates or swabs are taken from the site, and mostly for viral infections, that's where these are collected. You can also have other microorganisms like fungi, the candida, or you can have bacteria, the ones that cause pertussis or diphtheria, also being in the upper respiratory tract. Some cases can have people who are carriers. They harbor the Neisseria meningitidis or the Staph aureus in their upper respiratory tract, and they don't show any signs or symptoms of the infection, and then they end up infecting others. So for the upper respiratory tract, if Streptococcus, the pharyngitis type is suspected, the group A type is suspected, throat swab can be taken. In some cases, some facilities will take throat swab and then nasopharyngeal, depending on the request coming from the healthcare provider. Other viruses like herpes simplex virus, cytomegalovirus, or enteroviruses could also be harbored in the upper respiratory tract. So these throat swabs could be taken, especially for those who are carriers and then are spreading the infectious agents in the population. So for urine sample, we advise midstream clean catch so that you don't end up having microorganisms that are normal flora around the external genitalia. And once they get into the urine sample or specimen, they could be reported as positive. Meanwhile, they are normal flora from the external part. So you can also collect from the catheter or suprapubic aspiration if the person is not able to pass urine. But we don't encourage the Foley catheter tips being used to transport the specimen. It should be put into the right container. Don't collect the urine at the tips. It should be from the mainstream so that you can get the right infectious agent. And the samples should be sent to the lab as soon as possible, ideally within 2 hours of collection, and the results can be trusted. If the distance from the unit of collection is far from where they will be processed or analyzed, we encourage that they are refrigerated, but they should also be indicated that this is how. So we have 6 minutes, 4 minutes. Sorry. If you have any question, I'll pause here and then you can ask. Any question, please? Otherwise, I move on. All right. So specimen, skin, and subcutaneous lesions. You can have fine needle aspirates from these sites, and always make sure the needle and the syringe are also sterile. And right container, don't keep the sample or the specimen in the syringe for transport. Put them in the sterile container, well capped, and then labeled. Sometimes getting the fine needle aspirate will be a problem, and swabs could be taken from the sites. But always avoid the dry parts of the lesions or the necrotic parts. Microorganisms need water. So if the parts are dried, hardly would you find microorganisms in those sites. So if you take swabs from those sites, you are likely to report as negative. Meanwhile, they are present in the lesions. Then you can also keep these swabs in the transport medium. Example, the Stars medium, before they are sent to the lab, so that you can sustain these bacteria that may be present in the sample while they are being transported. Once you keep them in the transport medium and you introduce them into the proper medium for growth, the phase for adaptation is very short compared to keeping them in the raw tube without the medium. It take a long time for them to adapt and then multiply. That's why we encourage the use of these transport media. All right, so next week we talk about bacterial culture, how we grow these bacteria. Any question, please?
Yes, sir.
Yes. Hello.
Yes, sir. Please, can you talk slightly about semen collection for semen analysis? How the collection is done? Semen.
So the question will be, for what purpose? That is one.
Yeah,
Is
it's
it
for
to
semen. Yes, it's for
the
semen analysis.
viability?
Yes.
For viability.
Yes, please.
So here it's not about microorganisms, because semen even contains some antimicrobial properties, unless of course they are overgrowing. But for the analysis, you should keep them in the right container that does not have any chemical. The semen contains the cells, the sperm cells. So any chemical could destroy the cells. So the container should be sterile one, free of cells. And you don't keep them in transport medium because it's not for microbiological analysis. You're not going to culture any microorganism. So we don't encourage the use of culture medium. I hope it's clear.
Yes, please.
All right. So the purpose is always important. Why is it being collected? So that you know how to process those samples. Hello, Clement.
Hello, sir. Please, good afternoon. Hello, sir. Please, good afternoon.
Hello. Yes, we can
Hello,
hear
sir.
you.
Okay. There's this question I want to ask. I don't know if probably you touched on it and I didn't because I was having a network issue. So with specimen collection, I want to find out if you are taking a sample from wound for culture and sensitivity testing. Is it advisable?
We didn't get the first part. Repeat.
If you are taking a swab like from a wound to,
The question, please.
verify.
I'm not getting the question.
I'm asking when you
The
are
line
taking a
is
sample. when you are taking a sample from wound for culture and sensitivity test, is it advisable to?
Am I the only one who cannot hear him?
Is it advisable to clean the wound or irrigate the wound first before you take it, or you need to take it before you do irrigation or wound dressing?
Okay, so if you are going to dress the wound, sometimes the dressing would come with adding some chemicals, antimicrobial agents that will. So if you dress and then you take those specimen, in the specimen you may have the growth of the organisms. So always take it before. Always take it before and take it from the right side, because we want to know what is present in the specimen, what is present at the site. But once that part, you may have introduced some chemical that have antimicrobial properties. Is it clear?
Yes, please. Thank you very much.
So somebody is asking how long should the specimen for semen analysis be? You mean the storage time? You know, these are cells, sperm cells, so it should be as soon as possible. That's why for some facilities, depends on the protocol anyway. Some of them will refrigerate. Some of them, they also have some incubator-like material or equipment to keep these in them. So it depends on what analysis specifically they are going to do also. All right. So I think our time is overdue. We'll end here. You can reserve your questions for next week anyway. All right. So enjoy the rest of the week. Right.